So which of the following nerves is involved in a lesion in this patient?
Look to your left, look to your right, look to your left again, and to right.
Okay, so what do you think the problem is here? Which nerve is involved? Of course, you have, first of all, you have to identify which muscle is involved, and then you will come up with the nerve. The problem was here, the patient couldn't move the eyeball laterally.
Look to your left, look to your right.
See, now she cannot look laterally. So which muscle is responsible for that? Yes, go ahead. You are correct. But why did you say the right abducent nerve? Exactly. So this muscle here, the lateral rectus on the right, was not working. On this side, it was working, but on this side, it's not working. So it is the right abducent nerve. These are simple movements. These are not like complicated or compound movements. I will repeat that again.
To your left again, to
See?
right.
So the patient was able to move this eye medially because the medial rectus was intact. Medial rectus is supplied by the oculomotor nerve.
I'm going to shine a light in your eye, okay? So you look straight ahead. Sorry. Right.
But what have you noticed when you compare this eye with this eye? I will give you a clue regarding the eyelid and regarding the pupil. The pupil is dilated here. Yes. And what about the eyelid? Let me show you the video again.
I'm going to shine a light in your eye, okay? So you look straight ahead.
So he was actually pulling up this eyelid, but not this one. So it means that there is some ptosis on this side, and there is a dilated pupil. Do you think that this is related to Horner's syndrome, for example? What is Horner's syndrome? Horner's syndrome is due to lack of the sympathetic supply of the head. So, yeah. Okay, so what do you think that the sympathetic fibers will do? What is the action of sympathetic fibers on the pupil? In Horner's syndrome, you don't have sympathetic fibers, so what will happen to the pupil? You see, so this case doesn't go with Horner's syndrome because it's a ptosis and a dilated pupil. Okay, now why do you think? Can I have another student? Why do you think that ptosis happens in Horner's syndrome? Yes. So what does the sympathetic activity do? On which muscle it acts? Well, ciliary muscles, they act on the lens, not on the eyelid. So which muscle acts on the eyelid? Yes, levator palpebris. But levator palpebris superioris is a skeletal muscle. How come that a skeletal muscle receives an innervation from the sympathetic nervous system? Because part of it is smooth muscle. That's what we call it, the superior tarsal muscle or Muller's muscle. So it is this part of the muscle that will be affected in Horner's syndrome. But in this case, in the case of this patient who doesn't have Horner's syndrome, it is the skeletal muscle part of the levator palpebris superioris that will be affected. And this muscle is supplied by what? Levator palpebris superioris. oculomotor. All the extraocular muscles are supplied by the oculomotor except two. So the only thing that you need to memorize the two muscles that are not supplied by the oculomotor nerve. All the other muscles are supplied by the oculomotor nerve. So here we are more with an oculomotor nerve palsy. It goes with it. The oculomotor nerve carries parasympathetic fibers, and so the lack of parasympathetic fibers will cause loss of sphincter pupillae action. It's only the action of dilator pupillae that is working, and there is a paralysis of skeletal muscle part of the levator palpebris superioris.
So your right eye is having some difficulty moving medially, so towards the left and upwards. So if you try to look all the way to your left, try to look all the way to your left. I guess
That
you
hurts.
have. Okay. Yeah. So look down as best as you can.
No, looking down is not so bad,
And look up all the way.
but looking up,
And then look to the right all the way.
that doesn't hurt nearly as
So elevation, she has a little trouble,
Yeah. So elevation, adduction,
and adduction.
chest a little bit.
When he asked the patient to look medially, I mean, the affected eye medially, it was painful because she needs to use more of the medial rectus muscle, which is supplied by the oculomotor nerve, but she didn't have a problem when looking downwards. Why do you think that she didn't have a problem when looking downwards? Isn't the inferior rectus muscle is not working as well? Because inferior rectus is supplied by the oculomotor nerve. So why the patient was able to look downwards easily, but not medially? Perfect. Which is supplied by the trochlear nerve. Is still intact, and the superior oblique pulls the eye downwards. Although it is superior, it pulls the eye downwards. So she was able to look downwards by using the superior oblique. Okay, thank you.
If you are looking at the red reflex of the eye, and that means if you shine a light on their eyes or you take a picture, there should be a nice red reflex through the pupil, the black part of the eye. If you don't see the same red reflex in both eyes, that could be a sign of a problem. Now, when you take pictures with a camera, the red reflex, often it auto gets rid of the red reflex. And so if you see no red reflex, check your camera first and see if if you've switched the red reflex off, okay? Because we have a lot of parents come in and say, there's no red reflex. And well, yeah, it was your camera.
A holiday message from World Eye Cancer Hope, wishing you joy and asking, please take note. In this warm season's glow, when you capture its light, check all children's photos show red eye, not white. When the pupil shines white like a cat's eye at night, in a young child's eye can mean something's not right. A life-threatening condition, retinoblastoma or RB, that's childhood eye cancer to you and me. 8,000 children each year, both boys and girls. It doesn't discriminate, it affects the entire world. This holiday season, let's spread the word. Childhood eye cancer can be cured. Turn your camera's red eye reduction setting off. This one act can save lives and prevent vision loss. So capture each magical moment and smile. Check for white reflex before you edit and file.
Okay. The question is, what anatomical structure in the eyeball is responsible for the red eye reflection in flash photography? In other words, which of the layers of the eyeball is highly vascular? That's why it will cause the red eye reflection. That's the choroid, exactly. Yeah. So it's not the retina. Some people might think that it's the retina. Yes, the retina has some blood vessels, which are branches of what we call the central artery of the retina, which accompanies the optic nerve. But in fact, if you look at in the ophthalmoscope and the details of the retina, you will find branches of that central artery of the retina. But from far away, this red light reflex is not coming from these retinal arteries. It's coming from the underlying coat, or the coat that is outside the retina, which is very, very highly vascular. And in fact, the choroid is providing the main blood supply of the retina. Thank you. So here, this is just to remind you of what happens in cranial nerve 3, oculomotor nerve palsy, in just a few simple words.
Hi guys, hope you're having an awesome day. Really quick one, third nerve palsy, oculomotor nerve, the third cranial nerve. What happens and how does it present if it's damaged? Remember three things, P, PD, PDO. P, PD, PDO. P is ptosis, PD is pupil dilated, and PDO is pupil down and out. P, PD, PDO, ptosis, pupil dilated, pupil down and out. Simple.
So may I ask why the pupil will be down and out in oculomotor nerve palsy? In oculomotor nerve palsy, all the muscles, extraocular muscles, are paralyzed except what two muscles will be working? Yes. So what does the lateral rectus do? It is still functioning. What does it do? As the name indicates, from the lateral side, it pulls the eye laterally because it's attached anterior to the equator of the eyeball. Okay? So why does the eye go downwards as well? What about superior oblique? What's the function of superior oblique? Yeah, although it is superior oblique, but it's attached behind the equator of the eyeball, so it pulls the eye. In fact, it pulls the eyeball downwards and outwards at the same time. So it adds to the lateral squint of the eye as well. Medial rectus is not working, superior rectus is not working, so they cannot oppose, and even inferior oblique is not working, so they cannot oppose this action. That's the reason of the PDO. And what is the, may I have another student with me and to tell me what is the reason of P, the ptosis, in case of oculomotor nerve palsy? Which muscle is responsible for elevation of the upper eyelid? Which is supplied by? That's it. So here we have the oculomotor nerve is not working. So the muscle that's paralyzed here is this levator palpebris superioris, and it's causing ptosis. You should keep in mind that the oculomotor nerve not only carries motor fibers for the muscles, the extraocular muscles, but it also carries parasympathetic fibers. These parasympathetic fibers, they cause a pupillary constriction. They cause, at the same time, they cause contraction of the ciliary muscle, and so they will increase the curvature of the lens and are required for the near vision as well. So if they are lost, then the patient will have pupillary dilatation because there will be the action of dilator pupillae is unopposed by the action of sphincter pupillae, which is not receiving parasympathetic fibers. My question here, the parasympathetic fibers that come with the oculomotor nerve and supply the sphincter pupillae muscle, they relay in which ganglion? They synapse in which ganglion? The ciliary ganglion. Thank you very much. Now let's hear this young lady, Rin.
Hello, I'm Rin, and I wanted to talk about Horner syndrome. And basically, my eyes are unequal, so like this one's a little bit smaller, and the lid like droops a little bit, which can be really annoying when I'm trying to put on makeup. And I have some tricks, like if you notice this eye is a little bit darker than this one, to make it seem a little bit more even, because if I make them both all the way light. And then the other thing that goes along with it is sweating. I only sweat on one side. I know it has something to do with your nerves and it's like cut off, and I should really look up more about it.
So Rin knew that the condition has something to do with nerves. She mentioned that. Which of the following nerves is affected in her condition? It has to do with the sympathetic trunk. You're right. Okay. Yes. Horner syndrome. In Horner syndrome, levator palpebrae superioris has a smooth muscle part. Okay, and that's why when there is a sympathetic overactivity, like when you are angry, for example, you will not notice that. But what will happen is that your palpebral fissure will dilate, as well as dilation of the pupil, so that your eye will look bigger than usual, because the smooth muscle part of levator palpebrae superioris is acting. Okay, and so if the sympathetic fibers are cut, then you will have ptosis, partial ptosis, of course, not complete, partial, because the skeletal muscle part is still acting. So there will be partial ptosis. If you remember the case of the patient with Horner syndrome, you can hardly see the ptosis in that patient, especially because she mentioned that she put a kind of makeup that doesn't show her ptosis. But in other words, the ptosis is partial, because it's not the entire muscle that is paralyzed. The muscle has a smooth muscle part and a skeletal muscle part. The smooth muscle part is supplied by this sympathetic nervous system, and the skeletal muscle part is supplied by the oculomotor nerve. Does this make sense? You're welcome. Good question. Well, if you remember that even if the muscle is not in action, there is a slight contraction in the muscle. There's a tonic contraction in the muscle. Okay, so when a group of muscles get paralyzed, this the muscle will become flabby. There's no tone. So there's no tone in the muscles that are supplied by the oculomotor nerve. But there is a tone, even if you are not using them, in the muscles that are supplied by the abducens and the superior oblique and the trochlear nerve. So it's that tone of muscle that is moving the eye to the left and to the down, unopposed by the tone of the muscles that are supplied by the oculomotor nerve. You're welcome. Any other question? Okay, so let's share this video.
This question is from one of Hollywood's busiest actresses, as well as producers. She's the brains behind the blockbuster movies Mamma Mia and My Big Fat Greek Wedding. She also happens to be Mrs. Tom Hanks.
Hi, doctors. I'm Rita Wilson, and I would like to know what happens when your eye twitches. Can you answer that?
So, hygiene, there is that technical term, blepharospasm. If anyone has ever experienced it, it can be really annoying, particularly if you're, say, going for a job interview. It's an involuntary twitch of the eye muscle. Usually it only lasts for a few minutes. And the good news is, what typically brings it on, too much alcohol, too much caffeine, too much stress, not enough sleep. If you take care of those issues, usually it goes away on its own. In only very rare instances is it the sign of something more serious. So if it's not going away after a number of days, the other option, Dr. Ward, if it's totally benign but it won't go away, is
of course Botox, and it works. Vitamin B, but Botox works really well in the hands of somebody who's familiar where you want to inject it into that muscle that's spasming. It will take care of it.
Okay, so what is the muscle that is responsible for eye twitching? No, usually it is not. sometimes you might feel it in your upper eyelid, but there's another muscle in the upper eyelid, and there is another muscle around the eye as well. What's the other muscle in the upper eyelid? Yes, so that's it, the orbicularis oculi muscle. That's why he mentioned that you can treat it with Botox injections. Yeah, so the opponent will be lowering the eyelid, as in blinking. So in blinking, actually, you don't squeeze your eye. But if you want to squeeze your eye, then you're going to use the orbital part of orbicularis oculi. But this blinking movement that sometimes you are not thinking of or you don't sense, it is produced by the palpebral part of orbicularis oculi muscle. And the orbital part, the opponent of the orbital part, is the frontalis muscle of occipital frontalis. You're welcome.